since we're raising awareness about tech neck, could you briefly describe what tech neck is?
When I went to school, tech neck wasn't really a big deal. It's kind of a new thing that's come up because of just the amount of handheld devices we use. Computers have always been an issue, but now that we use cell phones and we have PDAs, we have handheld computers, we look down a lot more than we used to. But we did that a lot before too. We did it a lot. We used to lay in bed and watch TV from the bed or slouch on the couch. We just bring more knowledge to it because of cell phones. So I would say tech neck, by definition, is probably technology-driven pain that starts in the neck and is caused by just malposition of the neck for extended periods of time.
What age group do you usually see tech neck most in, and which age group is most at risk?
I know you guys all think that probably 13 to 25 is probably where tech neck usually resides, but it's not necessarily there. It can be anywhere. And being young, you guys are so used to using cell phones and again, technology that you don't care about your posture because it doesn't hurt as much. So you think the younger would be more affected, but older is just as affected because we have laptops and people that are older, they actually work longer hours and with under more stress a lot of times. So they can be just as bad. 35 to 55 could be really bad too for the same kind of thing. Not as much cell phone driven then, more laptop driven. So technologies can affect every age group. We don't see it a lot of tech neck in older population over 55, but we do see it again, pretty evenly distributed through all the age groups, probably for different reasons. Social media for kids, work for adults.
I see. Do you think the pandemic and increasing stay-at-home orders have had an impact on the cases of
It definitely has. Definitely has. Just one sec. I want to grab something.
Okay.
I forgot to grab because I wanted to grab some X-rays for you guys to show you what tech neck kind of looks like. Okay, so yes, definitely the pandemic has made it worse because why? I mean, all you guys are at home, all adults are home, everybody's home, and they're not using desks. They're not using standalone computers. Everybody's using more laptops. They're using more phones. They're being distracted more by technology than before because when you guys went to school, you guys got out and played in the afternoon. You weren't on your phones. There was distractions. Now the distraction is what? Talking to somebody on the phone, right? Or interacting with them or social media, right? People that are at work, what they do is they stay home because they're not going to the office. So what happens there is that I have a patient right now that came from Maryland and she's here and she says she worked for the government. Well, she's been home for 2 years. She goes, I'm okay, Dr. Thayer. I'm sitting on the couch. I'm very comfortable. I'm so much more comfortable at home. And so in her history, we discovered that 2 years ago, she started having pain. And so when she sits on the couch, guess what she does? She hunches on her laptop and leans over, and all that leverage causes her pain. So yes, the pandemic has caused pain for, again, children through school, but also through adults because they're not necessarily engaged in their work in a proper ergonomic fashion.
Yeah. So what is like the worst case that can happen if tech neck is left untreated?
That's a difficult one. I was looking at your question earlier about that. Worst case is relative, right? What's worse for you is not worse for somebody else. Generally, people with tech neck are going to have carpal tunnel. You guys know what carpal tunnel is? That's where you have numbness. You guys all know this. That's funny. You guys have carpal tunnel, which is you have pain down your fingers. That can lead to weakness where you're so weak you actually drop items. And so that can be a severe thing that you guys think of. But other severe symptoms could be migraines, headaches, really bad headaches that are debilitating that keep you from thinking. Lack of sleep because of pain from tech neck can also cause you to have anxiety, and depression can set in, which are not things that you normally would associate with tech neck, but those things are all possible. And I've seen them all. Other things that are less cerebral here that you wouldn't think of is dizziness, vertigo, where you really feel dizzy and lightheaded. And that can come from it because of imbalance in the neck can cause imbalance in the brain, which can cause this dizziness feeling. And lastly, something maybe a little more obscure is ringing in the ears, where you have pressurized ears, you go up in the plane, you feel that pressure, you can have that from tech neck. So all those things can occur, but the reason why they don't occur in everybody and they're different in everybody is how we adapt to the pain. So we adapt differently, so we have different symptoms, but the same cause is the tech neck. Good question.
And what do you believe are like the main treatment options for tech neck?
Main treatment is difficult to say. I'd like to say exercise and stretching would help, but it really doesn't, because we all go to the gym. We all try to strengthen our necks because we go, okay, if we have a stronger neck, that's going to stop us from getting tech neck. It's not really true, because think about this. If you stretch for, we'll say 15 minutes a day and you exercise 15 minutes a day, that would be a lot if you did that on your neck. Well, how long do you actually look at your phone? I mean, you get that little report on your phone that says how many hours a week you guys have looked at your phone, right? And it's ungodly amount of hours. We don't exercise enough to counteract that. So really, it's about, you could maybe do the opposite of this. Instead of looking down all the time, you could stretch your neck backwards to give yourself time to do the opposite. But if you're on your phone, say 4 hours a day, are you going to stretch the opposite way 4 hours a day? Yeah, right. So it's not really fair to say that something you could do on your own could fix that. Most important thing is stop looking freaking down so much, right? The more we look down, the more we look down at our phone or at our handheld devices, the more we're going to cause a reversal of the neck curve. And so I don't know if you guys can see this. Can you see these x-rays? Let's see. Let me hold on. I'm just my phone.
It's a little hard to see.
I'm gonna try this. You see that? I guess not. I thought it'd be cool show and tell, but I guess not. But what I'm showing you guys is an x-ray of a patient who's come in here. And the x-ray of a patient, our neck should be shaped a certain way, a curve. If you look at an anatomy book, it should be curved with your head forward. It should be curved this way, okay? Like this. And so with tech neck, you end up looking down and you cause permanent damage to your neck skeleton by looking down all the time. So my job as a chiropractor is to actually adjust it and push it forward in the right direction. But then if you guys are stupid enough to keep looking down, what's going to win out? You or me, right? And so that's really the dilemma here. And so you can stretch it backwards to kind of balance it out, but really you need to actually stop looking down so much and maybe bring your phone up a little more. You know, maybe have a static computer that's not looking down, you know, those kind of things. You got to prevent more than treat. Other questions?
You mentioned ways to prevent, but are there any other ways that we can prevent tech neck?
Yeah, I wrote a couple more things here. Again, the most important thing is posture. And so if you think of good posture, posture is going to always be the go-to here. The better the posture, the more you're going to prevent tech neck. Reorientation of your computers. So if you have, again, a standing computer, if your computer is down here and you're looking down all the time, how about this? Bringing it up to your eye level. So what? You're not looking down as much. Your cell phones, if you, and most of you guys probably do this, where you look at your phone down here, right? And you see lots of guys do that. How about you do this? I mean, just changing the orientation of your phone is going to be a tremendous way to prevent it. And then I always tell patients to do this who work in office situations where they can't get away from technology. Take a break every hour. I say set an alarm on your computer. Every hour, stop for 30 seconds. Just get up out of your chair, look around the room, and sit back down, and you'll be surprised how much that helps you too. Okay. Any other questions, guys?
Yeah, that was it. Thank you so much for your time today. It was really informative and it's gonna really help us raise
I hope
more.
so. Good. Send me the link on where you guys posted that. I'd love to see it.
Sure, yeah, of course.
Good luck, guys. Thanks for the call. I hope it helped.
Thank you.
Bye
Have a
now.
good day.